The Executive Director of the United Nations Population Fund, Professor Babatunde Oshotimehin, speaking on the International Youth Day 2013, noted that today we have the largest generation of young people the world has ever seen. He added that this is good for nations as it is young people that can transform the social and economic fortunes of any society. A growing population, however, comes not just with benefits, but also challenges. This is a focus on the sport today. My guest on the spot holds a Bachelor of Science degree in Economics from Wellesley College, Wellesley, Massachusetts, United States of America. She also holds a Master's in International Relations from Johns Hopkins Paul Nizze School of Advanced International Studies, Washington, D.C., also from the United States of America. She joined the United Nations system in 1993 as a staff of the United Nations High Commissioner for Refugees, UNHCR. She has occupied several positions, including serving as UNHCR representative to Mozambique and Deputy Regional Representative in the Democratic Republic of Congo. In 2010, she was appointed United Nations Population Fund, UNFPA, representative to Rwanda before coming to Nigeria as the representative of UNFPA in August. My guest is Miss Victoria Akyeampong. You're welcome, ma'am.
Thank you.
Going by your record, ma'am, it's clear that you have been so involved in humanitarian and development activities, especially in African countries. Am I right?
Yes.
Now, how tasking has this been in view of the kind of challenges we have all over Africa today?
As much as it's been tasking, I find it as an amazing reward professionally, because as you know, Africa is one of the regions that have been plagued with a lot of humanitarian catastrophes, be it man-made or natural disasters. And as a humanitarian, as I call myself, and a developmentalist, having joined the United Nations at quite an early age, I've had the opportunities to support people who have been in need as a result of crises in their countries, most of whom are women and children, to try and re-establish their lives in their countries of asylum. By countries of asylum, I mean people who cross borders to neighboring countries when there are crises, as is happening now in the northern part of Nigeria, where as a result of the Boko Haram insurgents, people are crossing into Cameroon and other neighboring states to seek protection and help. It has been an amazing opportunity because I see it as helping people to re-establish not only their lives, but supporting the states in which they have gone to now rise up to the occasion of supporting those who have joined them. I couldn't have had that opportunity should I not have joined the United Nations system.
Now, you just mentioned down that you joined at a very tender age, right? Now, what age are we looking at? And looking at the challenges now, what's one particular thing can you just pinpoint and say, this was very challenging since you joined the UNFPA?
I think the most challenging, in terms of tender age, what age was it? I understand women are not supposed to tell their age, but it was in my early 30s.
Okay.
Professionally, I think this is the time because United Nations, for most professionals, the cutoff year is 30 plus. So you are not really able to join as an international until you are 30 years and above, because that's when they believe you have some experience you could share with the nations that we're supporting. So I joined just a few years above 30. The most challenging, of which I pride myself, is the return of Angolan refugees who are in asylum in several countries in Africa and around the world to return home in the early 2001 when there was a peace brokered between UNITA, Savimbi and the government, the current MPLA government. It was a challenge because we had millions of Angolans around the world, and I coordinated the program that returned majority of them back to their nations, helped them to re-establish their lives in the various states in Angola. And today, most of them are ministers, the head of state himself, and we know the story of Angola and its prosperity to date.
That's good to hear. Yeah. Also, Madam, the mandate of the United Nations Population Fund places more emphasis on a world where every pregnancy is wanted, and every childbirth is safe, and also every mother is alive. How would you say your agency has fared in this regard?
In this regard, UNFPA, ensuring that every pregnancy is wanted, is reinforcing the knowledge of a woman and also a man in reproductive health, and giving them informed choices to decide when they wish to get pregnant, and making sure that when they do have children, they have the capacity to raise them appropriately, and that the woman also has the health required to have a healthy child, which requires proper spacing of the children.
But till date, most African countries are still ranked highly on the list of countries with highly maternal and child mortality and morbidity. What is your agency doing, to bring this down?
Most of the issues around high maternal mortality is lack of knowledge as to when to seek help. As you know, in Africa, most women deliver at home, and therefore they need to have skilled attendants close to where these women live. Is a major requirement to reduce maternal mortality. The second cause of maternal mortality is being able to decide when to seek help in a health facility. And the third is when they do arrive in the health facility, the timing in terms of support they get from the qualified health attendants to help them with whatever complications they might be having. These three delays is the main cause of maternal deaths and morbidity for pregnant women. What UNFPA is doing is to support governments to build capacity of health workers, to have an appreciation of the timeliness of interventions, to have the skills required to intervene, providing them with equipment in emergency obstetric and newborn care, to be able to intervene should there be any emergency situations in delivery, to train traditional birth attendants who are in the rural areas to be able to help women to deliver safely, and to provide equipment also to health facilities that would be required to have a safe delivery for women.
From what you've tried to explain to us now, it seems you are doing a whole lot, especially in Africa. Why is it that the issue of maternal and child mortality is still increasing?
I think political will also comes in. The political will in terms of government's commitment to allocate a reasonable percentage of their budgets to health, and not only that, ensuring that whatever we are providing in terms of the technical support is also matched by government funding to make sure that it is sustainable. So it is the lack of sustainability of the programs that are ongoing due to political will, for the most part, that perhaps leads to this issue of continued maternal mortality. But I believe we have made progress. Even if it's still high, there's been considerable progress in Nigeria, in particular.
I was even coming to Nigeria now. You've been in Nigeria for about 1 year now. Can you share your experience and probably look into areas that you feel should be corrected or that needs correction?
In Nigeria, the Minister of Health, or the ministry, is doing a fantastic job in terms of coming up with specific programs that will address maternal mortality. One such program is the SureP program for midwives service scheme. They have also the Save 1 Million Lives program that was launched not too long ago. We have the President's initiative in HIV/AIDS, amongst many, that is emphasizing the need for the government to step up and step to the plate in improving the lives of women in Nigeria. The challenge has been access, and access which could be attributed to poverty, and therefore inability to have access to services of trained health specialists, especially in the rural areas. To address it, there's been several programs that we could call social safety net programs that are being instituted in different states to support women, either in the area of transportation, to encourage them to seek health to seek help in health facilities. There are programs that contribute to the cost of their attendance. There are programs that encourage them by giving them incentives to seek antenatal care.
Let me not let you to let the whole cat out of the bag. I'll still take you up on that issue when the program returns. My guest is still the resident representative of the UNFPA in Nigeria, and that's Miss Victoria Akyeampong. And we have been talking on the growing population, prospects, and challenges in Nigeria. Madam, before we went on that break, you were talking about the recent developments by the Nigerian government, especially as it concerns the new program introduced for midwives, talking about the deployment of them to rural areas. How far do you think this can go in increasing access to orthodox Medicare in rural areas, and are there other strategies that societies such as ours can explore?
The midwife service scheme has been a success because there's been documentation about the reduction of maternal mortality in the areas where the midwives have been deployed. So that is a given. The challenges of the midwife service scheme has been, amongst many, the commitment of states to pay their salaries on time and their benefits. And therefore, there has been a bit of, let's say, a disappointment amongst the midwives who are deployed to remain as a result of lack of payment of services that they render, and has reduced the retention rate for these women who have been courageous, even after retirement, to go to rural areas where most people have not been interested in going to. What we could do more, because the numbers of midwives are limited, looking at the population that we have in Nigeria, would be to engage what we call CHOOS, which are community health workers, to be engage them more, to train them to be able to intervene in areas where midwives are limited. We could train traditional birth attendants, more of them, to help in safe delivery. these community health workers could follow pregnant women and report back to a specific health facility whatever challenges they see. So we should capitalize more on people who don't have the full, let's say, education as midwives, but who have the capacity to be trained to assist in safe deliveries.
Now, you just mentioned a very important point now, and that's education. What's the role of education in all these you're saying? How can it help to mitigate these challenges of maternal and child mortality in our environment? Education
is key. If you educate a woman, they say you educate a nation. But for me, I say if you educate a man and a woman and a community, you save the lives of many.
That's good.
And it is key because when you have information, you have the power to use that information to your benefit. And women who at least have completed up to primary school level, there are statistics that show clearly that they are able to avert a number of maternal deaths, and that maternal deaths occur in women who have less than a secondary education. Therefore, UNFPA encourages women to stay in school as long as possible so that they are able to make informed decisions and choices for themselves.
I'm sure if we continue on these maternal health and all of that, we will exhaust our time today. But let's quickly look at another issue, and that's issue of increasing population, which oftentimes makes what's it called, government apprehensive. But to you at UNFPA, it's a good news. Why is this so?
Good news if the increasing population, most of whom are young people under 30. In Nigeria, 2/3 of the population are under 30 years. And it could be good news because of the demographic dividend. If they are well nurtured, they are educated, they are offered opportunities of employment in the private sector, they could boost the development of a nation. But if they are not properly nurtured and given those opportunities, there could be a hazard to a nation. And we have seen examples of this in various nations where young people take up arms and could be a threat to society and to development. So yes, you can smile as far as you are putting your young people to good use, because it could be a dividend, a demographic dividend, and an economic boost and social boost to your nation.
So what's your organization doing to ensure that Nigeria key into these best practice?
We continue to build the capacity of relevant ministries. We also work with young people and the private sector, as well as CSOs, to empower the young people, to give them access to jobs. We support young people to be part of the political dialogue so that their views are taken into consideration. We work with them in the building of skills and the like, to make sure that they are competitive and that they are able to fulfill their full potential.
Talking about young people now, let's come to the issue of the youth. A very vibrant population of any environment, of any society, and even any country. It's a segment that cannot be ignored. You agree with me?
Yes.
And do you think, having been with UNFPA for some time now, a long time, do you think that this kind of attention is actually being given to this youth? Do you think they are getting their rightful place in the society?
It is coming. In Africa, we're getting there slowly, because after the situation in the Middle East, we have well understood, after Tunisia, and now what is going on in Egypt, that indeed young people are forced to reckon with. And in Africa, leaders have become very nervous of what happened in the Middle East and are trying hard to see how they can be an all-inclusive government, taking the views of young people into consideration. And in a number of countries, including Ghana, which I know very well, the recent political elections, the recent elections came up with a number of young people who've become parliamentarians and those who've been appointed as ministers. And I can say the same thing for Rwanda, that I know quite well. So we see a trend where young people are now making it into politics and into government. And I see it as a good trend.
Do you see this trend in Nigeria?
I have not had that opportunity to experience that as yet, but I know you have a number of young ministers. And what I can say is during the press conference a couple of days ago with the Minister of Youth, I liked what he said about making sure that those who represent the youth in this nation are young people who are not above 34, because there seems to be a trend where youth representation was of people who are older than 34. And I welcome that, because that will give us the opportunity to really get the veritable cadre of young people contributing to the economy.
Now, very quickly, can you lead us into some of the programs that you have been doing, in ensuring that this category of people, this segment of the society, assume their rightful place?
We focus mostly on the health of young people, because we believe a healthy people is a healthy nation. So UNFPA starts from a very early age of a young person's life, when they are adolescents, to give them sexual reproductive health information. And it's in the form of sexuality education, where young people who are in schools do receive sexuality education. We also help people out of school in the same information about their sexual and reproductive health. And we engage boys to also have a good understanding of what it means to be sexually healthy and how to avoid violence against women and other harmful traditional practices. In addition to that, we make sure that young people, adolescents, have access to reproductive health services. It's been quite a controversial area, but it is an area that the government has to meet up with and understand that there's a need for these young people to make informed choices to avoid things such as early pregnancies, unwanted pregnancies. In addition to that, we groom young people in the political life for them to have a voice as concerns policy making in their nations. We have young people who are ambassadors for their countries talking about population issues. These are trained and groomed by UNFPA. And in collaboration with other UN agencies, we do support the skills training of young people and also employment creation in the private sector.
You seem to have done so much, going by this list of various achievements that the UNFPA has been doing. I'm sure you're comfortable with that.
We are trying.
But
there's a lot still to be done. We're trying. We're getting there.
But UNFPA's presence in Nigeria has been for a while now. In specific terms, what are the areas that you can just mention in Nigeria that you have been involved, especially as it comes to, as it relates to the youth, this segment of the society?
The area we have been very much involved in
specific terms,
is building the capacity of youth to be able to make a contribution to the planning and the development of their nation by giving them that voice to make a contribution to government and to the private sector to reflect the needs that they have, the specific needs that they have to be incorporated in development plans and programs.
All right. The 2013 Youth Day celebration looked into so many areas. Adolescent pregnancy and migration seem to be the most pronounced Are there specific initiatives you're working on in these areas?
Our area in teenage pregnancy borders on what I've already mentioned, which is sexuality education and access to teenagers to services. In the area of migration, our focus is to draw attention to the risks of migrants and focusing on the young girls who are part of the migration trend and the susceptibility of these young girls to abuse, such as gender-based violence, trafficking, and the fear for them to seek help even when they are raped because of fear of being deported. So these are the areas, the health aspects that we focus on migration.
My guest has been the resident representative of UNFPA in Nigeria, Ms. Victoria Akyeampong, and she has been speaking to us on the growing population, the challenges, and the benefits. Madam, I'll have to thank you for coming on the program this time.
Thank you. Pleasure.
The program returns the same time next week.